I'm with Dr. Michael Acker, and we're talking about hospital-acquired infections are the most common non-cardiac complication after cardiothoracic surgery. That's your opening sentence on the poster. Obviously, it is a huge problem. Give me a little idea of why you did this particular study.
Because infections are so important for patient outcome, not only for the increased one's mortality, but also the quality of life after the operation, and also they're very, very important predictor of costs. So if we can eliminate or decrease the amount of infection, we can decrease the cost of cardiac surgery across the country.
One thing we didn't, which I just want to ask you in general here, is it well appreciated how important this is by cardiologists?
Infections are very well appreciated. I think the surprise to the field is that the infection we thought was most common, external wound infections, turned out to be the fourth least common. You know what I mean? So the pneumonia being more important, and the fact that you picked up, the infections often occur after the index hospitalization will be a surprising feature. And this work will be published, it just hasn't been published yet.
It's no surprise to anybody that they're fairly common. What was a surprise to me in your poster was the idea that oftentimes it doesn't show up until after hospitalization. I think of hospital infections as something you acquired in the hospital while you're in the hospital. What did you actually find in the study?
Well, I too was surprised by that. These infections are being acquired in the hospital, but there is a substantial number of them that their actual clinical onset is after they leave. You know, we get patients out very early these days, less than a week, very often after coronary bypass surgery or simple valve surgery, and the median time for presentation was 14 days, well after they leave. The other thing that was surprising was the most common infection wasn't a wound infection. The most common infection was pneumonia. So that was a surprising find.
So how many patients were you talking about here in this poster?
We followed over 5,200 patients in 6 months. We followed them for 2 months. This was done by all the members of the Cardiac Surgical Network, which was a network organized by the NHLBI. And this was a registry, a carefully done registry to follow these patients looking for all sorts of infections and to associate the infections with not only the patient characteristics, but also on processes that occurred in the hospital that might be able to be modified in order to impact and decrease infection.
Are you finding anything out of this study in regards to what we can do to stop this, slow it down?
This is just our first look at this registry. So in this analysis, we just focused on sort of gross results. Subsequent analyses will actually hone into things that are done perhaps differently among the different hospitals that might impact on incidence of infection.
So this is an ongoing operation that obviously, do you have a 2-year lifespan, 3 years, or is it just an ongoing period?
It actually is over. There was a snapshot in a 6-month period of time until we accumulated the necessary number of patients to make conclusions, but our analyses will be ongoing.
And so what specifically will you be looking for?
We're going to be doing a lot of analyses. For instance, what's the impact of blood transfusions, which we found were very impactful on various types of infection. What's the impact on types of antibiotics, length of antibiotics, types of antibiotics? What's the impact on various different hospitals use different antiseptics to cleanse the skin? Does that make a difference? So there's a whole host of things that we actually collected and will be looking at
in the years ahead.
Well, hopefully in the next couple of years.
I think it's a wonderful opportunity to look at these questions. Is there anything that we missed?
No, just how important this is. I mean, one of the focuses of CMS these days is infection and innovative strategies to prevent it from happening. It's very impactful for patient outcome and costs of healthcare overall.
Terrific. Thank you very much for your time.